you can all see my slides. Great, so thanks very much for the opportunity to present this evening. As Beck said, I'm Chris Eaton and I'm a Research Associate in the Wolfson Centre for Young People's Mental Health here at Cardiff University. And in this talk, I'll be discussing how Wolfson can work with Welsh Government to inform and evaluate national policy for youth mental health here in Wales, and why the Wolfson Centre is well placed to do this. So just a brief overview then. I'll start with an overview of the Wolfson Centre for Young People's Mental Health, and then I'll talk about why it's important for researchers to liaise with policymakers if they aim for their research to lead to policy changes. I'll then discuss how and why the Wolfson Centre is uniquely placed to be able to inform and evaluate policy for youth mental health, and finish with a summary of the key points of the talk. So starting then with a very brief overview of the centre. As Bex mentioned, we're a new interdisciplinary research centre focusing on reducing anxiety and depression in young people, co-directed by Professor Stefan Collishaw and Professor Fran Rice. And we want to work with Welsh Government to conduct research that is relevant to their policy priorities, and which in turn can contribute to informing and evaluating youth mental health policy here in Wales. Okay, so if we want to conduct research that can help inform policy, why is it important to develop links with policymakers? Well, whilst robust research findings are very important in the policymaking process, there are other considerations for policymakers, such as the economic costs associated with implementing a policy, the effects on social, cultural, economic and environmental well-being, and how the policy fits in with the current programme for government. If we want our research to rapidly inform policy and practice in youth mental health, we need to ensure our research considers key policy questions or priorities, that it has the capacity to evaluate current policies, and that any research findings and policy implications are clear and accessible to policymakers. So I'll now move on to discuss the expertise and resources the Wolfson Centre for Young People's Mental Health can access that makes it well placed to be able to conduct research which can inform and evaluate youth mental health policy in Wales. So the first point to discuss is the multidisciplinary expertise of the Wolfson Centre. We bring together academic and clinical experts in various aspects of youth mental health, and this is reflected in the structure of our 5 research work streams. The first work stream will seek to identify risk and protective factors for depression and anxiety using large-scale, longitudinal data. The second aims to identify the genetic and environmental factors that could contribute to anxiety and depression, and to explore whether we can separate and classify different types of depression based on genetic risk factors. The third work stream explores new interventions to support young people and families where a parent suffers from depression. The fourth will look at the role schools play in promoting positive mental health in young people. And the fifth will use population data uniquely available in Wales to better understand the long-term outcomes of young people who experience anxiety and depression. And all of this research will be guided by international scientific experts in mental health research via our Scientific Advisory Board. And we'll also liaise with clinicians, schools, the NHS and Welsh Government on our research aims and the best way to implement research in policy and practice via our Implementation and Engagement Board. Importantly, we'll also seek feedback about our research questions, methods and findings from young people with lived mental health experience themselves in our youth advisory groups. So we can see then that our centre has a strong general infrastructure that will allow us to conduct policy relevant research that could have a direct impact on the lives of young people with mental health difficulties. I'll now move on to talk about some examples of some more specific resources we have access to that allow us to work with Welsh Government to inform and evaluate policy. So the first example then relates to the evaluation of Welsh Government mental health policy in schools. Over the last 10 years, the Welsh Government has pursued a strategy known as the Together for Mental Health, with the broad aims of improving mental health awareness, building resilience, and improving the accessibility of support for people with mental health difficulties. A focus has been given to schools, with school counselling services having been introduced by the Welsh Government over the last few years. And moving forward, Welsh Government will be implementing the whole school approach to emotional and mental well-being, whereby schools act as hubs for improving mental health awareness, for building resilience, and can act as a first line of support for those experiencing emotional difficulties. So how then can we evaluate the impact that this policy will have on young people's mental health? But one of our research work streams in Wolfson focuses on understanding mental health in schools, and this is led by Professor Simon Murphy and Professor Graham Moore. This work stream will use the Schools Health Research Network, or SHRN for short, which is a partnership between the Decipher Centre, Welsh Government, Public Health Wales, and Cancer Research UK. 210 secondary and middle schools in Wales are involved with the network, and every 2 years, SHRN surveys pupils in these schools. Since 2019, this survey has included validated measures for mental health, and in the 2019-2020 survey, around 120,000 young people took part. In addition, schools themselves are surveyed about their environment, policies, and practice. We can see then that this is a hugely important resource and provides the framework for understanding how a change in school mental health policy, such as the whole school approach, may be associated with a change in pupil mental health over both the short and the long term. And more broadly, the timing of the SHRN surveys, with one being in 2019 and another one happening again at the end of this year, means we will soon have measures of pupil mental health before and after the onset of the COVID pandemic, allowing an understanding of the ongoing and longer term impacts of the pandemic on pupil mental health and supporting the planning of appropriate COVID recovery strategies. But what about assessing mental health outcomes beyond the school years? Well, uniquely in the United Kingdom, Wales has access to anonymised national data sets on clinical outcomes covering the vast majority of the population. For example, data sets on GP diagnoses or emergency department attendances. These data sets are collated and can be anonymously linked together in the Adolescent Mental Health Data Platform and via the secure anonymised information linkage data bank. Professor Anne John leads the Wolfson workstream, which focuses on using these resources to explore the onset, course, and outcomes for people with depression and anxiety. And with participant consent, the SHRN data that I mentioned earlier can be linked to SAIL records, allowing us to explore the impact of national changes in youth mental health policy on young people's well-being beyond the school years. And something else to highlight about these resources is that in the Wolfson Centre, we're interested in testing interventions to help reduce depression and anxiety. For example, earlier I mentioned Professor Fran Rice leads a work stream developing and testing interventions to prevent depression in adolescents who have a parent who is experiencing depression. In mental health intervention studies like these, participants may drop out and it's costly to follow them up over a long period of time. Again, with participants' consent, we have the capacity to link participants' data from intervention studies such as these to their clinical records in SAIL. And so in this way, SAIL can support efficient, low-cost follow-up in intervention studies over a long period of time. And something else to highlight is that the Wolfson Centre has created a linked research post with Welsh Government to help support research policy relationships, and that's the role that I'm in. So to help ensure our research can inform policy, I'll be working with researchers in the Wolfson Centre and with colleagues in Welsh Government to ensure researchers liaise with policymakers throughout the cycle of a research study. Currently, we're looking to set up regular meetings with the research leads from Wolfson and the mental health policy leads from Welsh Government so that they can set out their policy interests and key questions, and we as researchers can advise how we can potentially address these. And to ensure our research findings are accessible to policymakers, we'll aim to disseminate our findings across multiple channels, including in publications that don't have paywall restrictions, on social media, and in briefings to policymakers. We'll also aim to make sure any policy implications of our findings are clearly stated in research publications. And finally, in addition to helping with the ongoing research of the Centre, I'll be looking to work with colleagues in Wolfson and Welsh Government to co-design new pieces of research. For example, we're currently considering a study which explores the views of young people on the Together for Mental Health strategy to help inform the next iteration of this strategy. So when ensuring our research is policy relevant and can lead to rapid change to the lives of young people, another very important consideration we need to consider is the view of young people themselves. And I mentioned earlier about how we discuss our research questions and findings with young people in youth advisory groups. So just to go into a bit more detail about this, we're currently looking for young people aged 14 to 25 with lived mental health experience to take part in our youth advisory group. They'll help us to identify key questions of relevance to them, advise us on how we undertake our research, and help us understand what the findings mean for young people with lived mental health experiences. We're still recruiting for this group, so please email wolfsonyoungpeople@cardiff.ac.uk, just here if you're interested in taking part. And that email address will remain at the bottom of the slides as we go through the presentation. So to summarise then, I've spoken about the need to liaise with policymakers from the outset in order to conduct research which is able to inform and evaluate policy. I've highlighted how the Wolfson Centre is well placed to conduct research that can rapidly translate research to policy change with our multidisciplinary expertise, resources such as the Schools Health Research Network, the SAIL Data Bank, an adolescent data platform, our linked research post with Welsh Government, and our advisory groups and boards who help to guide our research. And all of this is, of course, particularly important in the context of the current pandemic and the many changes young people have experienced over the last 18 months. That brings us to the end of the presentation. Thank you very much for listening, and I'm happy to take any questions.
Thank you very much for that, Chris. I think judging from the Mentimeter contributions we had from the audience, hopefully that kind of gave everybody a really good overview of where we're at with the Wolfson Centre at the moment. And as Chris said, if anyone's got any questions, please do pop them in the Q&A box. So we've had a question, Chris, from Siobhan.
Oh, sorry.
What plans do you have to include third sector organisations in your research? There's a wealth of information and engagement with young people that could easily be missed without this.
Yeah, that's a great question, and thanks for asking that. So, yes, that is very important to include third sector organisations in the design and implementation of research. So part of my role will be not only liaising with young people themselves and Welsh Government, it'll also be looking to liaise with mental health charities to consider their priorities, their key questions moving forward, because of course they have lived experience and expertise in these areas. So that's definitely something we'll be looking to move forward. And there's numerous mental health charities in Wales that could help us with that, like Man Cymru and MQ as well. So that's definitely something we'll be doing.
Great, thank you. Any other questions? Oh, question from Emma, Chris. Similar to Siobhan's questions, will the data be gathered from SHRN be accessible by third sector organisations?
Thank you very much for your question. So I'm not directly involved with SHRN, so I won't be able to provide a definitive answer to this. I don't think so. I mean, any findings from SHRN studies obviously will be shared, as I mentioned, in a general sense in publications and social media, but in terms of the data itself, I don't think that would, in terms of raw data, be accessible. I think bodies, if they want to use any data gathered on platforms like that, have to apply and go through an approval process. But certainly findings from studies relating to our work will be disseminated in publications and on social media and other channels like that, if that answers your question.
Okay, thanks, Chris. And another here from Nikki. She said, can you give an idea of what rapid response looks like to you in terms of a whole school approach? What if young people can't attend?
So a rapid response in terms of a policy change. Yeah, that's an interesting question. Obviously, especially in the current circumstances, you know, some young people are still shielding and aren't able to go to school. That's something that's really interesting to consider actually moving forward, because of course, in surveys of school mental health, they'll be done based on school experiences. So if the young person can't attend school, obviously that's individuals there who are being left out. In terms of a rapid policy change, I'm not sure what that would look like actually for that particular population. That's a really interesting question and something I think we'll have to consider moving forward. But I do think it's important to include, for us to consider groups such as young people who can't attend school, and obviously young people who have mental health conditions who come from other populations like those with neurodevelopmental syndromes. And I think by us liaising with young people, with charities, with our advisory boards and our youth advisory groups, we'll be able to hopefully cover all of those different groups so that we don't miss anything like that. But in terms of a rapid response, yeah, I'm not quite sure actually. I think that's a really good point and something we need to consider.
Okay, thank you. And another question from Siobhan. Chris, what age range will the research look at?
Yeah, so Wolfson looks at young people, and I believe that's broadly defined as 10 to 25, up to the age of 25. I think there's some capacity to look at younger children as well, but within all the various different studies, the age ranges will be slightly different. So some will perhaps look just at adolescents, some at younger children, but overall I believe it's 10 to 25. So, you know, we're covering key periods of adolescence where young people are particularly vulnerable to emotional difficulties and to developing mental health conditions, and also as they move forward into young adulthood and up to around 25, so that we track key changes in participants' life. And I think that's particularly important in the context of children in clinical services who transition from child and adolescent mental health services to adult mental health services, to continue to track individuals as they move into those services rather than just being lost. So we're aiming, that's the broad age range that we're looking at.